Good morning, everyone. As I mentioned last week, it's been now 5 weeks since we saw our first step towards normal. It's been a little over 2 weeks since we opened up took our first biggest step as we fully opened up manufacturing and construction. That makes this week an important time to look closely at the data, so we're doing just that, and we'll share the latest with you on Friday. But based on what we've been seeing to date, it appears we continue to move in the right direction, which is good news. And as a result, we'll be able to put more Vermonters back to work, open up social activities, and restart most parts of our economy in some capacity. And all of this is thanks to the commitment and sacrifice of Vermonters. You put your family and neighbors' health first. And if we continue to do that, we'll be able to keep moving forward. But while it's tempting to declare victory based on the numbers here in Vermont, as I've said many times, we're not an island. So we also have to keep an eye on what's going on around us. We know that many of the states in our region still have a significant number of new and active COVID-19 cases. For instance, since Sunday, New Hampshire has experienced 240 new cases and 43 deaths, while Massachusetts has had 2,000 positives and 675 deaths. In the same time, Vermont has seen 13 cases and 0 deaths. So as you can see, our careful, cautious approach must continue. To help us better measure the risk of COVID-19 spreading here from other states, I've asked my team to identify regional benchmarks to use in our restart strategy. As Commissioner Pichek showed on Friday, new cases in Maine, New Hampshire, Massachusetts, New York, and Quebec can have an effect on us here in Vermont. So with that in mind, I've asked my team to think about what we need to see in these other states to tell us when it would be smart and safe to open Vermont, to welcome back our out-of-state travelers. They're working on that because I know how incredibly important it is to our tourism and hospitality sectors and to protect the jobs they provide. Because if we do this right and view this as a marathon, not a sprint, we'll win this race in the end. As we watch the data, we've also planned our next steps forward. Last week, I mentioned we're hoping to give a time frame for our next phase of close contact activities, like cleaning services and indoor fitness on Friday. As well, watching the data in recent weeks and looking closely at CDC guidelines, it still appears we'll be able to announce increased gatherings from 10 to 25 by the end of the week. And while child care centers and day camps have the option to open on June 1st with health and safety measures in place, we're also finalizing guidance for overnight camps and hope to talk to you about that in the coming days as well. Looking ahead a little further, if we continue to see good results, I expect we could be able to resume indoor dining in the not-too-distant future. None of this has been easy, and I know it's especially difficult and stressful for business owners and workers alike who are trying to comply with new rules or waiting for their businesses to restart or their jobs to return. As I've said before, this is a moment of service for all of us, and I appreciate everyone's patience, kindness, creativity, and commitment to public health as we fight back against this pandemic and work towards returning to normal in a way that keeps Vermonters healthy and safe. We'll have more details on all that on Friday, so I'll now turn it over to Dr. Levine for a health update. Dr. Levine.
Thank you, Governor. I know this is a COVID update, but I would be remiss to ignore the temperatures. On the drive over from Burlington, it was between 85 and 87 on my car's thermometer. So it is hot out there, and that was only at 10 in the morning. We Vermonters know how to handle cold weather pretty well. In the last number of years, we've had to increasingly learn how to deal with hot temperatures as well. So anybody who's outside, and especially if you're working or exerting outside, definitely start slowly, drink more fluids than usual, drink before you're thirsty, take extra breaks in the shade, find a cool place indoors. And as so often is the theme at these conferences, worry about the most vulnerable. If there are older ones or ill people indoors, or they live alone virtually or by the phone, check in on them. If you need to stop by their home, remember to keep your distance and wear a facial covering. Next, I wanted to address our data, but in the context of a recent news report on one of the more popular news stations that actually regards Vermont as a state in trouble as it's reopening, with an increase in new cases over 50%. One of 18 states that they viewed in trouble, one of 5 that they viewed as in the highest degree of trouble, though they never commented on Vermont itself. Let me lead you through our data slides and dispel any notions that the reopening process has been problematic in Vermont. But it's easy to show how one can draw misleading conclusions from case data, whether you want to show positive or negative data. So obviously here's where we are now, 971 cases. We have almost been at 2 weeks of only 54 deaths without any increase, which is remarkable in itself and very noteworthy for the low number of deaths in our state compared to anywhere else in the region. And the next slide, obviously we're flattening the curve, that goes without saying. It hasn't changed dramatically as one can see. Here's the number of new cases that are reported. One could technically say there was a 50% increase on this day when there were 2 cases and on the following day when there were 3. Or even a greater than 50% increase when there were 3 cases and then 7 cases. But I think you can all see that there's very few cases on a daily basis, and there's minor gyrations in those numbers in a setting where we're actually testing more than we've ever tested before, hundreds and hundreds and hundreds of tests, approaching 1,000, and only a few positive tests per day. So our incidence rate, the rate of new cases developing in Vermont, is very, very, very small. If we go to the next slide, this is our test positivity rate. So it's coming down, 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 but for quite some time now, it's been hovering actually below 1%. So in the setting of testing many hundreds of more cases on a daily basis, the percentage of them that are positive is very, very low. And then finally, the last slide just shows our syndromic surveillance data, again showing that the number of people complaining of COVID symptoms, and certainly the number complaining of influenza-like symptoms, is pretty much bottoming out. Very low percent of people coming to urgent care centers or emergency rooms with those complaints. This is why we do this kind of in-depth analysis to inform all of our clinical and our policy decisions. And we need to continue to watch the data very closely as we see the impact of the reopening process, no denying that. And we have to wonder if our population is changing behaviors. We've all been watching television, and over the Memorial Day weekend, not in Vermont, but in other parts of the country, there were very compelling and dramatic pictures shown of really total abandonment of social distancing, total abandonment of facial covering, total abandonment of not congregating in large group settings, at least in these photos. I don't want to accuse these states of having across the board not kept with what they should be doing to adhere to good policy with regard to COVID. But clearly the report saying that things are not going well in the reopening in Vermont, I hope I've convinced you that it's anything but the case, and that we clearly have not seen an uptick in any of that data that would get us concerned. And that's in concert with the kind of data we showed you last Friday that we'll show you again in a couple of days. So we would hope that even if there were a small outbreak or a small uptick in the number of cases in Vermont. The impact of good hygiene practices, adhering to facial coverings and physical distancing guidelines, along with our robust testing and contact tracing capacity, would work in favor of controlling the spread of the virus rather quickly. And finally, there are now many more opportunities for Vermonters who have no symptoms to get tested at pop-up testing sites around the state this week and next. I want to remind you that if you have symptoms and are concerned you may have COVID, you should interact with your healthcare system and get tested through that route, not through the pop-up route. And if you go to our website, www.humanresources.vermont.gov, there's a section on pop-ups. But I'll just inform everybody here while I have your attention. Today, pop-ups are in Brattleboro, Morrisville, and Rutland. Tomorrow, Barre, St. Albans, and Hartford, White River Junction. Friday, Middlebury and St. Johnsbury. Monday, Orleans. Tuesday, Essex and Springfield. Wednesday, Brattleboro, Morrisville, and Rutland. Thursday, Barre, St. Albans, and Hartford, White River Junction. Friday, Middlebury, and St. Johnsbury. So abundant opportunities. If you got put on a waiting list at one of the previous pop-ups, inevitably there will be room if you call in to set up an appointment at one of these. Thank you.
With that, we'll open up to questions.
Start with Calvin.
Thank you. So, as you're probably well aware, the 2-week quarantine rule for out-of-state visitors is taking a big toll on the travel, tourism, restaurants. I guess, when will we know when we can lift the 2-week quarantine rule? And I guess, is there any semblance of hope that, we can have a tourist?
Well, there's always hope, and we will have a tourism season, so to speak, in the not-too-distant future. I firmly believe that, based on what I'm seeing in other states as well. And as I said in my remarks, we're trying to develop some metrics, benchmarks, in order to determine when we can open up our borders and relax some of those quarantine issues, because I think it's important to our state and our economy to do so, but not until it's safe. Take, for instance, New York. When I look back 2 weeks and look at the number of positive cases they had 2 to 3 weeks ago, it was 15,000. Now, last week, they had 10,000. This week, it looks like they'll be down to maybe 6,000 or 7,000. So you can see a dramatic decrease over just 2 weeks in New York. So we're going to see the same. They were just a little bit ahead of Massachusetts. As you might remember, we saw the first cases in New York, and it escalated quickly from there. It wasn't soon after that we had Boston experiencing the same thing. So they are probably a couple weeks behind New York. So this is all good news as we see this drop. But that's why I've asked the team to develop some of these benchmarks so that we can determine when it's safe, because we want to be able to articulate that to Vermonters.
And I guess just a quick follow-up. So today, of course, it's sweltering out. This summer, how do we prevent a sense of complacency among people and wearing masks? Kind of on a 90-degree day, people might not want to.
Well, it's difficult to be perfectly honest. What we have to do is continue to educate, to make sure that during press conferences like this, that we talk about the dangers of this virus, and to make sure that we're all doing what we can to prevent the spread and prevent it from affecting our family members and those who are most vulnerable. So if we continue to do the right thing, we'll get through this a lot stronger. And I know on these days when it's very hot, we have to keep in mind that if you can physically distance yourself from others, you don't have to wear a mask if you're outside, if you can physically separate yourself. So it's not as though you always have to wear the mask. You just have to make sure you're not in the vicinity of someone else. Dr. Levine, anything else you want to add to that? Any of that?
That's That's perfect.
Stuart?
Thank you. On the reopening, you mentioned daycare is June 1. For 3 weeks now, there have been people outside your office here who say that the $6 million in grants that you've offered will allow them to open, but then they'll close again. They run out of money. They don't have the equipment or the sufficient staff to meet all of the requirements. So I guess my question is, what would closure of the daycares soon after they reopen, if these folks are right, what would that do to your plan to
Yeah.
start the economy?
Obviously, we need the child care centers to be open in order to open up the economy, to put more people back to work. And that's why we tried to preserve them through this crisis and had grants in order to keep them alive and so that and to survive, so that when we got to this point, we'd have something intact so that we could open that back up. I might ask Secretary Smith to comment further on this.
Stuart, great question. I just want to take us back a little bit because it's important to put this in context. Let me take you back to the week of March 21st when we didn't know what the trend was with the virus, and during that week, the stay home, stay safe order was initiated, and as you know, we closed all those programs, including child care programs, except those programs that could offer slots for essential workers. And here's what Vermont did that's different than many other states. Vermont took the highly unusual step of instituting a program that utilizes both state and federal funding to replace the revenue that child care providers normally receive from families and publicly funded child care subsidies. That meant that you didn't have to have a child there. We funded it, and as the governor said, we did that primarily to make sure that the infrastructure was there. This was $12 million that we dedicated to child care stabilization and was established to make sure that the economy, when we start to reopen the economy, that it was something that the child care providers would have to have stabilization during that time when they didn't have kids. Unheard of as we move forward. I think I saw a national publication where we were one of 5 states that took any sort of initiative in terms of making sure that we stabilized this. $12 million over a 2-month period. That's got to be put in context here in terms of what we did during that time. A component of that was making sure we had slots available for pre-K and actually up to 8th grade during that time. And as I said, this program was lauded nationally. Not only did we put the $12 million in, we added another $6 million to help the daycare open back up. Child care centers open back up by helping them fund different things for supplies, the health requirements that we're saying. So we're talking about $18 million over a 3-month period for child care centers. Vermont has been very, very generous in this area. And we continue to work with child care centers to make sure there's flexibility in the funding mechanisms that we have in order to meet their needs. We continue to work with child care centers to make sure that they have the supplies that they may need, whether it's sort of the minimum PPE that we talk about in terms of face masks or rubber gloves, the cleaning supplies in terms of wipes, those sort of things. Vermont has nothing to shy away from in terms of what we've done for child care centers. I know there are some that want us to continue this program, but in terms of stabilization grants and keep child care centers closed. But we have consulted with the health department through Brina Holmes, a well-known pediatrician. The health department assures us that we can open up in a safe manner, in the manner that we have outlined, in the manner that will be economically viable for these organizations. And I think we've done this in a responsible way, a very responsible way, if you think about it, in terms of how we invested. At some point, we need to get back to some semblance of normal, and that's what we're doing now with child care centers.
If I could just follow up, Governor, on Friday, you alluded to a decision that you were going to think about over the weekend. Will you seek re-election this fall?
That'll be more vivid on tomorrow. I'll come out with a statement then. I have until 5 o'clock tomorrow, but I have arrived at a decision, but I'll make that known tomorrow.
So no hints. I just.
Question, Steve?
Yes, I do actually. Governor, during the after the 9/11 crisis, you'll remember back then that especially New Yorkers were starting to look at Vermont for investing in real estate, and several folks found moving up here and telecommuting was the way to go. The realtors came out yesterday and said that they're seeing a big increase in online sales of Vermont property to out-of-state buyers. Does that concern you, or?
No, I've been advocating for more people to move to Vermont for quite some time. You remember the remote worker program that we worked on with the legislature that was successful. I believe that we are a safe state in many ways and a healthy state. So the numbers here have shown that even during this crisis, we're still healthy. So if we can get more people to move to Vermont, I think that's good news. I think it's good for the realtors as well. They were very concerned in the beginning about what this would do to their industry, and it has proven that it's been actually thus far beneficial for them.
To follow up, affordability though for people who are living here and affordable housing.
Yeah, we still have an affordability issue here in the state on many different levels, but certainly housing is one that we're still trying to address. We had a major package that we came out with 2 or 3 years ago. We're going to have to continue to make sure that we have affordable housing for Vermonters.
All right, moving to the phones, we'll start with Peter from VPR.
Governor, people are starting to get out and about again with the beautiful weather upon us, and we've been hearing stories of widely varying rates of compliance with social distancing, with face mask usage in places where it's advised. Are you using any state apparatus to monitor or surveil compliance with those public health orders?
Well, some of the public health orders are being monitored. I mean, there's a complaint tab, I believe, with public safety and with ACCD. But anecdotally, we're watching as well for compliance. So we have throughout this process. So we're doing what we can. We want to make sure that we educate as well as we provide the guidance. We hope people will do the right thing, but it's difficult to enforce, admittedly.
Right, but are you sending teams out with the express purpose of observing and monitoring to see what the situation on the ground is?
I don't think there's specific teams that we've been sending out. Obviously, when we open up parks and so forth, we'll be asking them to monitor the situation, provide that guidance. We've asked law enforcement to do the same, but not any specific teams that are going out to enforce.
Thank you.
Joe, Barton Chronicle.
Hello, Governor. Moving along in the same line, clearly at some point we want visitors from out of state, but part of the reason we've been so successful here in flattening the curve is that there's been a lot of compliance with regulations about social distancing and mask wearing. Bringing in people from places with higher rates, even if they're lower than they have been, are you considering making things like facial coverings mandatory, at least for a period, so that folks from out of state will have more incentive to comply with what has worked for us, and also merchants will have a little more leverage in insisting that their customers are masked.
Yeah, Joe, as I've said before, we're trying to monitor the data to make sure that we open the spigot a little bit at a time in terms of our lodging and restaurants and so forth. So there's not an attraction at this point for people to come to the state. And we watch their numbers decrease. That's all good news. And I see that we will be having more out-of-state visitors and be welcoming those visitors here in the state. In terms of mandatory mask or facial coverings, I've said that I didn't believe that that was the right approach at this point in time. Did give some flexibility to those communities, those municipalities who wanted to take further action to make it more mandate facial coverings in their own communities, knowing their communities better than I would. So some have taken advantage of that, some have not, but I put it back in under local control.
Okay, thank you.
Mike Donahue, the operator.
Good morning, Governor. The wedding business is apparently taking a bath in Vermont. The Islander has a front page story today about the historic Grand Isle Lake House closing suddenly, leaving 22 couples out in the cold or heat, I guess, this summer. We've been told other wedding professionals are struggling. Couples are not getting their deposits back for various vendors, including musicians. Lake House apparently sent about half the money back, but they had to pay their property taxes and other business expenses. What can the state do to save these businesses, but more importantly, maybe save these marriages, couples that may want to stay in Vermont, like you were just mentioning?
Yeah, I hadn't heard of the closure of that facility in Grand Isle. That's really unfortunate, but it is difficult. It's difficult for us to determine when we'll be able to open up to out-of-state visitors. We are anticipating we'll be going from gatherings from 10 to 25. Hopefully we'll make that announcement on Friday. But I would also remind everyone that we put forward a $400 million economic package for recovery, both to survive and thrive. So in that initiative, there is some help for those who are struggling and not sure whether they're going to be able to continue. I might ask Secretary Curley if she could provide any further information on what a business like that could do in terms of the package that we put forward that might be helpful for them if the legislature passes the initiative.
Yeah, Governor, I think you nailed it. I mean, we have proposed some grants and low-interest loans with very long amortization periods that folks in the hospitality industry, including the wedding industry, would be eligible for. So, again, I know that it's critical that people get relief soon, and we're working on that. But that would be one way. Certainly, there are still some federal loan options, but those are hard because I think in this particular industry, because there is so much unknown, it's harder to apply for some of those federal loans, not knowing what the timeline is for them being back up to at least a partial scale.
Yeah, I think they've applied and they had no luck. One follow-up question.
Just again, Mike, that might have been the SBA loans, some of the federal loans, but this is a different package, and we're hopeful that the legislature will follow suit and pass the initiative so that we can offer this as soon as possible to these struggling businesses.
Okay. And just as a follow-up to Joe's question, with all the out-of-staters flooding in here, when can Vermonters expect the daily health department reports to resume showing the number of out-of-staters in their respective states that have positive tests, especially with all the tourists now flooding in, and also for the daily reports, any progress on providing the town-by-town report on a daily basis instead of a weekly report?
Yeah,
It doesn't seem to be very hard to add that to the report.
a couple of things. First, I want to just quantify the flooding of out-of-state visitors into the state. We have been keeping track of some of the data, and when I checked this morning to see what transpired over last weekend, because it appeared to me that there were more people coming into the state than in previous weeks, and we did have our largest volume traffic day on Friday, which was about, I'm going to guess, about 60,000 coming into the state on Friday versus the week before, which was about 50-something. So it wasn't dramatic, but there is an increased number of people coming into the state. They were from the 4 states that we probably figure 5 states, New York, Massachusetts, New Hampshire, Connecticut, and they seem like there might have been another, but those are the 4 major ones anyhow. In terms of when, we'll put the out-of-state folks back in, right now we're just not seeing a lot of increase, as you've seen from our modeling. I don't want to turn it into an us versus them situation. We've seen that in other states. We're better than that. We'll take care of this. We'll open the spigot a little bit at a time to make sure that we don't have that flood of people into the state. But we need them at some point. So just as quick as we can, we want to welcome them in with open arms. So we don't want to cause any problems beforehand to make them think otherwise about the state we love.
I don't think it's an us versus them. It's a reality. I mean, these people are being assigned counties that they don't live in. They just happen to maybe be there, or maybe that's where the test is. I'm still not sure where the last number I saw, 49, I think, New Yorkers were tested positive in Vermont. Why not list the New Yorkers?
I think
we're tracking the number coming into Vermont, it seems like.
I didn't get that last part, Mike. I'm sorry.
It seems like you're tracking the number of cars coming in from out of state, from New York and everything. Why not track the actual people positive tests from New York, Massachusetts, and release those numbers?
Well, again, some of those people that you're assuming are out of state or happen to be out of staters in terms of residence, but most of them have lived here most of their lives. So again, I'm not sure that determines a whole lot when we see the small numbers that we were showing today. But if we see a dramatic increase, obviously we want to be transparent, but we saw the situation down in Hartford where someone saw a New York plate and just assumed the worst, when actually that family were Vermonters. They've become new Vermonters about 3 months ago. So people just assume the worst, and we want to prevent that from happening.
All right, we've got to move to our next questioner.
Go ahead, Mike.
Well, I'm just wondering, can we get those numbers for Friday? That's not telling people where they're living or anything like that. That's not license plates. That's the number of New Yorkers or number of out-of-staters by state that have tested positive while here in Vermont.
We're going to play tag. We're going to play tag team here. I'm going to let Mike Smith take over.
I was afraid of that.
You should be. I just want to reiterate a couple of things. One, the daily numbers that you see have the total number of people that tested positive in this state. So if you're from, I've said this before, if you're from New York or New Hampshire and you tested positive in this state, that number is included into the daily numbers. You can be from Antarctica and that number is included if you tested positive in this state. Mike, let's try to get what you need, because I think it's readily available. Let's try to get what you need offline, and we'll work on that for you.
Great. Thank you very much.
Wilson, the AP.
Hey, good morning, everybody. I have 3 questions. Hopefully they're pretty straightforward. One, I just before we get on this call, I clicked on the health department's COVID dashboard, and I see that today there are currently 0 patients hospitalized with COVID. That I assume that's more symbolic than having a real on-the-ground scientific importance, but I'm curious if any one of you would like to think about that one publicly. And then secondly, Governor, just what is your up-to-the-moment thoughts on the legislature's vote-by-mail proposal? I've seen a lot going back and forth, and I'd just like to get your most up-to-the-moment thoughts. And finally, I'm told that yesterday, Vice President Pence had a meeting with governors. I don't know if you were on that one or not. And he urged governors to start sending CARES Act money to local governments. And I was wondering if you could give us an update on how that process is working, of getting federal CARES Act money to local governments. And those are my questions.
Yeah, I'll take the third one first because it's the one I remember. I would say in terms of the call with Vice President Pence, I was not on that call yesterday, so I don't know what his message was. In terms of the municipalities, we're working to make sure that we're covering their expenses for COVID, and we'll determine that in the next package as well, because we haven't released all the money from the CARES Act. So that's a concern of ours, and we'll see what they do in the future as well. There was I know there's an initiative in Congress. We've spoken to our congressional delegation, Senator Leahy, Senator Sanders, Congressman Welch, about helping to fill some of the voids in both our state budget and municipal budgets. And in fact, the Congress, the House has passed something. It doesn't appear that the Senate's going to take it up. So, but we're hopeful that in the future there'll be more funding available that we could put to use. But at this point in time, the CARES Act money is just for COVID relief. So if there was COVID expenses from municipalities, we are gathering that information so that we can make sure that we can provide assistance for them. But it won't help in terms of their budget gaps or our budget gaps either in the state. In terms of the voting procedure, let's just walk back a little bit. If we go back 4 weeks, when the Secretary of State had said that we had this emergency, we need to act now, and we need to plan ahead, I said, sure, let's go ahead, let's move ahead. I believe in planning. I believe we should put something into place and hope for the best. Expect the worst and make sure that we have a plan in place. So I said, move forward. Well, he wanted to do it in one step and just go right from last month to November. I suggested that we reflect on it after the primary, knowing that we wouldn't be able to do the ballots and prepare those until after the primary anyhow. So I wanted a two-step process. He came back. He wasn't, I wouldn't say he would rather have made the decision then, but the legislature gave me the authority to work with the Secretary of State on this issue. So he came back and said instead of opting in at that point, that we would have an off-ramp, make the determination after the primary. And I'd said, sure, let's move ahead, let's move forward, let's put the plan in place, order all the materials, do everything you have to do. Congress has given you money, it's $3 million, the feds have given you money. Let's go ahead with this plan. But I'd like to see a different body determine whether we should have this off-ramp. And I said we should have a designee from the Secretary of State, a designee from the Governor's Office, the Commissioner of Health, a designee from the town clerks, as well as a designee from the Mayor's Coalition. These 5 people would determine whether we opt out, but we're planning ahead, we're surging forward, we're saying yes, let's go ahead and plan, let's put it into place, and hopefully at that point, maybe there's a vaccine, maybe there's something that would tell us we don't need this. Having said that, the legislature now, it's appearing to me that it's becoming more partisan than anything else, because I've been saying, let's move forward, let's spend the money, let's go ahead. And then I'm hearing back that I'm standing in the way and I'm a roadblock. I am nothing. I'm not a roadblock. I'm saying, let's do it. The only caveat I said was, let's have an off-ramp at this point in time. I thought there was agreement to that. And having a body, a neutral body, objective body to determine that. And by the way, one of the provisions I'd like to see is no one running for election in November should be part of that committee. I think that Vermonters would appreciate that it's an objective panel that takes a look on, just based on facts, whether we should move or take the off-ramp. But otherwise, if they didn't think so, we'd be moving forward with a mandatory ballot for every Vermonter. So again, this isn't philosophical for me. It's more about practicality. And I'm not standing in the way. I'm saying, let's do it.
Okay, thank you.
There was one other question you had. I think.
0 hospitalized COVID patients today.
It's good news. We'll let Mike Smith deliver that first.
Wilson, the website will be updated. It's really good news, but the website will be updated. It's going to be one COVID inpatient today when the website is updated. We have no COVID in ICU, no COVID in ICU plus vented, just one COVID inpatient.
Okay. Okay, thank you.
I'll give the reflection you asked for.
That is what I was looking for, yeah.
There's always a small number of under investigation in the hospital, so keep that in mind. Some of those in subsequent days may actually test positive or be presumptive positive for COVID. But this is why we could announce last week about the reopening of the healthcare sector. More and more of the healthcare sector, including inpatient procedures, because clearly the hospitals are not being overwhelmed with COVID-positive patients in need of intensive care. So from that standpoint, it's a consonant with all the other data that we've been presenting all along. It's another great metric to show that Vermont's in a good place and that the reopening activities, both in the healthcare sector and in all the other sectors, are being appropriately launched and timed. We're not in any danger at this present time of endangering the capacity of the healthcare system.
Okay, thank you all.
All right, Sean, the Chester Telegraph.
Thank you. This is for Secretary French. 3 months from today, schools here are scheduled to open, and we're wondering what, in concrete terms, is the agency doing to help those school systems plan for the host of different contingencies and scenarios, both health-related and financial, that they'll be facing?
Good morning. This is Secretary French. Thank you for the question. Yeah, we're involved in a fairly significant planning process with districts and various stakeholder groups, such as the superintendents and principals and the Teachers Association, to begin that planning process. It's fairly complex. I will say the Department of Health has a major role in that. We are meeting this Friday again to begin structuring that planning process. But, you know, it's going to be a major undertaking for everyone, but our goal is to have in-person instruction in the fall, but there's a lot of things that have to be addressed in order for us to do that safely. So we're working on that. The districts will be actively engaged in that planning process over the summer.
When would you expect the process to begin? It sounds as though it's not begun yet. And who will be heading that up?
I'm leading it up. The process for the local level should begin after the 4th of July. But we have to frame it out. I would say my impression is other states are in a very similar position. There's a lot of information to digest. And certainly, as I mentioned, the Department of Health, we defer a lot to their expertise on this. But it's a very complicated issue, and that's for good reason. I think schools are often the last aspect of our society to reopen.
Do you see having something concrete early enough for the school districts to be able to implement it?
Yeah, that's a great question. I mean, that's sort of the challenge we've had with a lot of our guidance. You know, there's never quite enough time for folks to work on things, but it's the nature of the emergency, and if we do things too too early, then we're not taking advantage of the latest health information. So it's sort of navigating that sweet spot, if you will. I think we're going to time to put out some preliminary information the next week so folks can take advantage of in-service days at the end of the year with teachers and staff to begin that sort of initial framing of their plans. Then after the 4th of July, asking them to finalize their approach. And then we'll work with them closely over the rest of the summer to implement those plans.
Would that include perhaps lowering the number of days for this year so that there would be more time for planning?
Well, that remains to be seen. I think we will, the issue of time, I think, is a theme that emerges through a lot of the plans of the state, how we schedule instruction, school calendar, and so forth. But that's exactly the kind of issue I want this larger stakeholder group to help inform the decision on.
Thank you.
Kat, WCAX.
Good morning. Could you reiterate for us how, as we open businesses, but in some case limit the services that they can offer, how people who work in those are supposed to make up the wage difference? Are they able to collect some unemployment still? I mean, the example that's kind of popping into my head right now is like a salon where they offer haircuts, but they also offer other personal care services like waxing or something like that. And where stylists can go back to work, if their specialty isn't hair care, they might not make their full income. So can you just tell us how they're supposed to navigate that situation?
Yeah, I believe unemployment would still be available, or the PUA. I might refer to Commissioner Harrington on that.
Thank you, Governor. That is correct. If they were previously working full-time and saw a reduction in the number of hours they were working per week, then they are available for partial unemployment. And again, that just means if they were working more than 35 hours prior to the shutdown and now are coming back working less than 35 hours per week, they would be available to partial unemployment.
And got it. So the fact that they might be considered self-employed is not a factor in that.
So it would only in terms of what they're earning per week. But again, if they were self-employed working full-time and now we're only working part-time, that would play a factor. And
okay,
again,
thank you.
It would depend too if they were providing, independent contractor services. One issue that we have run into multiple times and are looking to the federal government for additional guidance is individuals who own their own business who are working to keep the business open, let's say a restaurateur, but isn't taking a wage from the restaurant while they're trying to pay the bills for the restaurant. That becomes there's a conflict in current state and federal law where that person essentially is working, but again, they're not earning a wage. And so that creates a duality there that we're working to process through.
Okay, thank you.
You're welcome.
Avery, WCAX.
My question is about senior care facilities. So we've been getting some viewer questions and comments just about whether there might eventually be some sort of workaround to allow families to visit their family members who may not be at end of life but are getting up there in age and they want to spend as much time as possible with them.
Yeah, we certainly can understand that, and we are working towards something where we see some hope in the near future, where we can allow them to visit their family members. Commissioner Levine.
Thanks for that question, Avery. I understand how heartbreaking it can be to see families and their loved ones unable to visit for so many months. We're actually very grateful to so many of these families for adhering to these restrictive limitations and recognizing that all of us, caregivers, community leaders, family members, are doing all we can to help them live in a safe and thoughtful way. There has been recent guidance released by CMS, Centers for Medicaid and Medicare, and a lot of this involves conditions for what they term reopening, just like we use that term for so much of what's going on now, from our economy to all the other sectors. And how to integrate testing into those decision points, what phase the state is in its handling of the pandemic versus what state an individual facility is in. And so it's really our work to analyze and assess and develop a Vermont-specific plan using this guidance and using our own stage of development in Vermont with regard to the pandemic. And basically, it will involve a renewed and more invigorating testing program that's being recommended really for the first time at the federal level in as expansive a way as possible. And I don't want people to get the idea that facilities have been a roadblock. Facilities are always engaged in discussions with us, both at the Department of Health and the Department of Disabilities, Aging, and Independent Living, to try to be less restrictive, especially as the weather has warmed and the opportunity perhaps for outside visitation, well-spaced, becomes more of a potential reality. But even to just get to that step, based on the new regulatory guidelines, would take a number of interventions along the way, including testing protocols amongst them. So basically, we are very proud of our track record in Vermont. As we know, over 50% of the 54 deaths were in 2 of the nursing homes early on in our experience with COVID-19. And knock on wood, we have done extremely well without disease at any great extent in the majority of the other facilities. So we want to preserve that wonderful track record, but be compassionate and understand that visitation is really core and critical and important for all concerned, both the patients and their loved ones. So we will, in the coming weeks, I think, be able to provide a more in-depth plan of how we'll approach this and how individual facilities can use the strategies we develop to satisfy the reopening criteria that they've been presented with. Is that good enough, Avery?
It is. Thank you very much.
All right, Lisa, the Valley Reporter.
Hello, this question is probably from Michael Harrington. In addition to self-employed people who are going to continue their eligibility for the unemployment insurance, what about food service people throughout the state? When in-restaurant dining resumes a reduced occupancy, will servers still be eligible to file partial unemployment claims, and will they also still be eligible for the CARE supplement through the end of July?
Thank you for the question. It really depends less on the business and more on the individual, in that if they have seen a reduction in hours from full-time to part-time or a complete elimination of hours, then they would be eligible to continue to receive benefits. Again, I'll remind those out there that are claiming unemployment insurance benefits that if you are offered full-time work at the same rate and doing the same type of work, then there's an obligation for that individual to accept the work unless they have a COVID circumstance that prevents them from going back to work. So in those cases, if a restaurant opened but only rehired half of its staff, the other half that were not offered jobs would still be eligible to collect unemployment.
And if they are returned, but they are returned at 25% capacity, in theory, servers and bartenders are making 25% of their wages. Are they still eligible?
So it's a little more nuanced than that. It's not a straightforward question. So it depends on how much they're earning and what the difference in their hours was from prior to current. So again, if they were working full-time and came back part-time, yes, But again, there are some caveats there in terms of whether they're earning a certain number of times the benefit amount, and so that creates another scenario there. But again, if they were working full time, came back at a drastically reduced schedule, they would likely be eligible to continue to receive benefits.
Thank you.
Thank you.
Greg, the county courier.
Hi, Governor. I wanted to start with a follow-up on Mike Donohue's question earlier. We're also hearing from customers who've booked wedding venues and other events, and they are unable to get their deposits back. I know you mentioned your $400 million business recovery package that you've proposed to the legislature. Would you like to see a requirement in there that businesses return that money in order to qualify for a package, a recovery package?
I'm not sure what their contractual relationship was with those who were seeking their services. I would think there was some mechanism to get their money returned, but obviously this is going through the legislature. It'd be a great issue for the legislature to address while they're going through it. If they deem that necessary, we'd move forward. But obviously we'd like to see people get their money back.
All right, and another follow-up question that I had, if you remember, I asked probably 4 or 5 weeks ago about the DMV being closed and young Vermonters not being able to get permitted or licensed. As you know, in rural Vermont, like Franklin County, access to driving is really a huge factor, especially for young people. What's the DMV doing in order to make sure that people are able to get behind the wheel legally?
Yeah, well, it's a great question. I know it's on the minds of many. I remember back when I was anticipating getting my driver permit or my driver's license, it couldn't come quick enough. So I understand their anticipation. But the DMV is working on a plan right now. We hope to announce that in the very near future as to when we'll be able to open up to some of those services so that we can get these new drivers on the road.
Are you looking at waiving any of the testing requirements? Say if a student has gone through a state licensed driver's ed course in a school satisfactorily, or any other testing requirements that may be waived?
Again, I'll wait until the DMV comes out with what they're planning. But I know this has been a bit controversial amongst those who oversee the programs. So not everyone is on the same page. So I know they've been trying to consider, make some of those considerations, but at this point in time, when we open back up, we just want to get them through the process as quick as possible.
Thank you, Governor.
Andrew, Caledonia Record.
Yes, good afternoon. This is, I guess, for Secretary French, as a follow-up question along the lines of preparing for the next school year. I'm curious about jurisdictional authority. You mentioned that the plans for next school year would maybe be in place by around July, the beginning of July. School districts would be able to start implementing them. Do those plans pertain to independent and private schools, especially as it pertains to dorm programs? We've got several schools over here in the Kingdom with sizable dorm programs, and I'm just curious how they can go about beginning their recruiting and planning for next year.
Yeah, it's a great question. I think, we'll probably follow the same trajectory for our planning as we did with the continuity of learning, where we required school districts to submit a plan as well as approved independent schools. And then we were able to work sort of on the smaller independents that don't necessarily fall into the same planning requirements. But I think the planning requirements will be essentially a planning requirement, not necessarily a compliance requirement. So we're we're trying to navigate that ability to provide direction, but also allowing flexibility for folks to create solutions that we haven't anticipated yet. But I think my guess would be it would be the same process that we had previously with the continuity of learning, that there'll probably be some smaller independent schools that will have to deal with on a one-off basis to help them come up with a plan.
So, but you would, the AOE would be requiring of the independent schools to submit plans for approval in order to be able to run a dorm program and other functions along those lines?
Not necessarily for approval. We are requiring, I would expect, approved independent schools, and those include the larger institutions that don't necessarily have dormitory programs per se. But we will be requiring them to have a plan of operation to address the public health issues that are largely the significant part of the planning process, in addition to including provisions for the continuity of learning, because we expect, as much as we hope to go back to in-person instruction, that we're going to have to still continue to plan to have some version of remote learning in the future.
So I guess then, if it's not necessarily an AOE requirement and necessary approval, who would be overseeing and authorizing the functioning of dorms? I mean, in a way, they're kind of like hospitality arrangements. So is there another state government entity that would be responsible for allowing those functions and setting the guidance they need to abide by?
Yeah, they're currently
not for Secretary French, but
yeah, I can follow up. I apologize for the confusion. If the schools are regulated by the agency currently, meaning if they're approved independent schools, then we will provide guidance to them on this planning process. What I was suggesting was that the planning construct itself will be more of an assurance construct as opposed to a compliance construct. It's not so much that we will be evaluating each institution's ability to meet that plan, but we are asking them and requiring them to make plans, and we want to help them, particularly to address the public health issues that will emerge through their educational environments, comply with those plans.
Okay. And hopefully not to take up too much more time, but for the governor, a slightly off-topic follow-up. We over here at the Caledonian get a lot of emails, calls, and just to get cornered on the street from people who want us to ask, when will it be our turn to open up the local museum, the community swimming pool, the bowling alley? Do you feel like there's adequate information getting out there, or where would you point folks like this? Because it's not a single sector; it's it's a cross section. Where can people turn to get these questions answered, and is there better outreach that might be needed for them?
Yeah, some of that is on the ACCD website. That would be the best point of information, and also I believe maybe Secretary Curley can answer part of that. Then I'll come back to it.
Sure.
Yeah. I think if you're okay with it, would you just ask the question again?
Yeah, and so it doesn't seem like a day goes by where one of our staffers isn't asked by either a business owner or someone running the local museum or the community swimming pool, the Kiwanis clubs. Everyone sort of seems to be scratching their heads about when it'll be their turn to open up and what they can tell their customers or their patrons. And so they always say, when you're on the next press conference, please ask for us. And so my question is more, where should these folks and these organizations turn to make sure they're getting the latest information, and is there better outreach that needs to be done to help them plan and prepare for their eventual reopening?
Sure. Okay. So I think the first thing that would be helpful is if people went onto the ACCD website, accd.vermont.gov, and sign up for our newsletter. We send that out every other day, and that's where we point to any recent reopenings or recent announcement about something that is going to be permitted to restart. So there are certainly going to be areas where we don't have the information yet about openings, but like you heard the governor talk today about making an announcement Friday about additional businesses that will open up. So as soon as, we're ready to make those announcements, we put that in the newsletter. The guidance for things that have been open, so the pools, for example, that those are permitted, again, at a lower occupancy, but the information is on that website as well. If folks are having trouble finding that information, they can always email us. That's an option as well, and we try to help people navigate that the best we can. We'll give them any information that we have and try and communicate. We also do a fair amount of communication on our social media, but we're trying to get the word out the best we can. But if there's a signal that we're not doing well enough, then I take that feedback and we will work to try to broaden that. But it would be helpful if people were on our newsletter, because that's a great place to be updated by the minute.
There has been situations where some have not known that they've been able to open. So we've had some confusion amongst a few people, and so we want to make sure there's a lot to keep up with. And that's why we want to communicate as best we can. The museums in particular are going to be coming up fairly soon as well, and it'll probably be some sort of like a 25% reopening.
Okay. All right. Very good. We'll let everyone know.
Thank you.
All right, Colin, VT Digger.
Yeah, hi, Governor Scott and everyone else. I was going to just quickly follow up on that DMV comment you made. You mentioned that those who oversee the program are having a tough time getting on the same page about how to move forward. And I was wondering if you could just talk about the differences in opinion there.
Yeah, I haven't been involved in the discussions. I just know that there's various opinions on the issue. So I would probably refer you to Commissioner Manoli, who is not on the call today, but would certainly be able to answer some of those questions.
Great, thanks. And then I was wondering, have you heard from retailers? I know that the Grocers Association, I think, was going to poll survey its members on how they felt about a mask order for customers and businesses. I'm wondering if you've received the results of that survey or other demands from chambers or retailers.
Have not, at least not to my knowledge. What I've asked them is to collect the data and the information, the polling and so forth, before we take another turn of the spigot and open from 25 to 50%, and then we'll make a determination at that point whether we seek more rigid compliance or not. But at this point in time, I have not heard back from them.
And have others in your administration heard back from them?
That's what I'm just not aware of, because nobody's told me. So I haven't, I just don't know.
Okay, thanks.
Eric, Times Argus.
Yes, Governor, you've been turning the spigot for a little over a month now. Compliance, depending on where you go with masks and social distancing, is variable. We've rapidly increased testing, nearly 31,000 people tested. As you've noted, surrounding states are not doing as well as Vermont is. And yet we're still really seeing good numbers in terms of positive tests. Like a spike these days is like 8 cases. So how is the state doing so well, given all the circumstances it's facing?
I think we laid the foundation to begin with. We took compliance seriously. People did the right thing. They socially distanced themselves, then physically separated themselves, and they did all the right things. We closed a lot of entities down, which was unfortunate but necessary in the beginning, and we took quick action to do so. So having that good solid foundation to begin with has led us to the point where we're seeing good numbers now, but it was all because of what we did in the beginning, I believe. So at this point in time, unfortunately, we're still, watching the numbers in the surrounding states, because it will affect us in some way, because once we can't secure our borders. So once we open up a little bit further, we know that there'll be more activity and more visitation from those other states that are still having problems. But again, there is some light at the end of the tunnel. It appears that their numbers are starting to reduce, And once they do, we'll be able to open up and get back to somewhat normal.
Thank you.
Ann Wallace Allen, VT Digger. Ann, VT Digger.
Hi, can you hear me now?
We can.
Sorry about that. Hi, my question is about restaurants and indoor dining and about, you sort of dropped indoor dining might be in the offing at some point, and I wanted to, because I know restaurant managers and owners will be wondering if the infection rate continues to remain about what it is now, which is very low, what is your best guess for when indoor dining would be allowed and what would it look like? And I also have a follow-up about sleepover camps.
Yeah, difficult to determine the exact date. Obviously, I wish we could tell everyone when that was going to be, but I see it in the very near future, and hopefully we'll be able to make some further announcement in the next week or so on in-person dining, interior dining. So we'll see, but at this point, I can't say specifically, but I would say that it's one we'll be doing in the near future.
That's kind of a turnaround. This is the first time you've mentioned anything like that. I mean, you just opened it up to.
Well, I've been trying to foreshadow what's going to happen in the future as we see have more optimism, and we see our numbers continuing to stay level. I think it gives us again some hope, and so I want to make sure that we are able to communicate that with people. So I want to make sure that we knew, a couple weeks ahead of time that this is a consideration.
What about them? That those are places where infection is likely to happen.
Part of that you dropped out there, Ann. Can you repeat the question?
Oh, I was asked. Yeah, it was the same question, sort of about gyms, which is or fitness facilities that you have mentioned will be likely to open in the near future, or at least we'll have an announcement coming. A lot of people have mentioned that those are places where they're concerned that infection is likely.
Well, again, they'll be under strict guidelines and strict procedures as well, and reduced capacity. So we feel at this point in time we're going to open them up at some point, but it will be under a different situation, and they'll have, again, increased guidance, increased oversight in terms of making sure that everything is sanitary and that we're not exceeding the capacity at this point in time. It'll be a reduced capacity.
All right. Okay, thank you. And the last one is about overnight sleepover camps, because they tend to attract people from out of state. So how would that work? Not just the kids who come up for the sleepover camps, but often their parents come up to drop them off and stay in area, lodging if they can. How could you put all that together?
Yeah, that's difficult, and we're working through that as we speak. So trying to determine whether there's going to be some quarantining before they get here, and certainly they have to go through the rigors of their physicals and so forth, and whether there's any testing then. So we're trying to consider all of that. We'll have some more information on that, I believe, on Friday, but I'm not sure, maybe next week.
Thank you so much.
Aaron, VT Digger.
I think this is a question for Levine and maybe Smith. What is the state doing to prepare for the event of a second wave? Are there any provisions made for potential surge capacity, or are there any plans made for the surge capacity that's already available?
Yeah, well, we've already gone through a practice run, so we have everything in place and we can set it up very quickly. But I'll let Secretary Smith answer that.
I think the governor answered that very well. We went through a hell of a practice run here in terms of what was going on and what our response was. Our surge capacity, we haven't eliminated the surge capacity. We've dismantled it in some regards, but it is still in various storage phases as we move forward. We've also learned a lot in this and our response. So I think, as we plan, and obviously you talk about testing, we always talk about making sure we have enough tests as we move forward. We talk about planning in terms of the number of tests that we have available, not only to do the tests that we have, but test in reserves that we may need in case of surge. So that planning continues on a daily basis as we move forward. It will probably get more intense. We're still in this crisis right now, and as we sort of plan in this crisis right now in terms of what we're doing in the future, that Dr. Levine talked about long-term care testing. That's going to be integral as we go into a surge and how we do the testing in terms of long-term care facilities. So there are many elements that we learn through this surge that will just transform into if there is a next surge, and we hope there isn't, but if there is, that will transform into the next surge. Plus, our medical surge units we have not thrown away. They are in the ready in case we need it, as well as other things that we're doing.
Thank you. And Secretary Sherling?
Oh, I'm sorry. Did I step on?
No, I think he just might have something more to add to that on the surge front specifically. Commissioner Sherling?
Yeah, good afternoon. Thanks, Rebecca. And between the governor and Secretary Smith, I think they covered most of it. But just to sort of walk you through the key things that we're preparing for, as the Secretary said, the field hospitals remain at the ready. We're also doing some additional planning around what those hospitals could look like because we have time to plan for a more robust version of them. The testing and tracing work that the Department of Health has going on. We're working on our PPE stockpiles, assessing what number of days of equipment we believe we'll need if there is a surge, and making sure that we have that in stockpile. Ventilator orders are still inbound with a number of different strategies there to ensure that we've got those on hand. The Agency of Human Services is also working on contingency isolation strategies that could be used if we had another surge, and there are a number of different potential fallback positions on all of those and different levels that could be deployed for each one of those strategies.
Okay, thank you.
Brittany, Local 22.
Hi, yes, so I just have a clarification question. On the guidance in regards to child care under cloth facial coverings, it says it's required that all staff wear cloth facial coverings, but then below it says it's recommended. I was just wondering, is it required that all staff wear facial covering, or is it just a recommendation? I had some people tell me they were a little confused about this guideline.
Commissioner Levine.
For the staff, it's the requirement. I think the wiggle room comes in young children, making it's very hard to enforce that for a very young child, but the staff for sure.
Okay, so staff 100% required wear facial covering. Okay. Thank you so much.
Ed, the Newport Daily Express.
I have no questions, thank you.
Thanks, Ed. Taylor, Channel 7.
Can you hear me?
We can.
All right, so my question will probably just go to who can best answer it for me. As you anticipate reopening the state, could you maybe elaborate on how you see things like campgrounds reopening and maybe what that'll look like as we go further into summer?
Well, certainly we've already opened up campgrounds to 25%. At this point in time, our state parks will be open sometime mid to late June and probably at a decreased capacity. And then we'll start, once we get everything around 25%, then you'll see us moving 25 to 50% across the board. So that's the vision, but hopefully throughout the summer, we'll be able to increase the capacity.
All right, thank you.
Steve, NEKTV?
Hello, can you hear me?
We can.
But Governor, have you or will you use cell phone data to monitor location of Vermonters and their traveling? Number two, with the license plate.
Why don't we just take those one at a time, because I'll forget what the first question was. In terms of the data, we are contemplating the SARA alerts, but that's not something that we're tracking anyone. At this point in time, we're not using anything to track people.
Okay, and regarding the license plate data from people coming from out of state, seeing how we've lost twice as many people, young people, in the prime of their lives to opiates, is law enforcement using license plate data to monitor drug dealing?
Again, what we're doing with that data is just to determine what state they're coming from, just the color of the plate. There are no registrations being utilized. License plate numbers aren't being kept track of. It's just the color of the plate at this point to see, the volume of traffic and so forth as we open up Vermont a little bit more, what we should expect. So that's all we're doing with the data.
Okay, and regarding the word spigot, how did we arrive at the word spigot? Was like hand pump and faucet already taken?
I hadn't thought about hand pump. Faucet could have been used. I could have used rheostat as well. It's just a variable trying to measure the amount of flow and current and so forth coming through. So it was just something that I think was, from my standpoint, was familiar to many, and so I decided to use that terminology.
Great. Thank you, Governor.
All right, Guy Page. Guy, are you there?
One more time, Guy.
Okay, we're going to move to one more questioner. Our final questioner will be Tim from the Vermont Business Magazine.
Hi, Governor. I have a question for you and then one for Dr. Levine. You had mentioned a week ago that you wanted the legislature to turn around your $400 million plan in a week, and now it's been a week. I'm wondering where that stands and what you hope the timeline will be.
Yeah, I don't think I said a week. I said as soon as possible. A week would have been great, but I know that they have to, it has to go through the committee process and go through some of the testimony that they're hoping to take from us and from others. So my hope is just as quick as they possibly can. We know people are in need, and we think it's a good package, and so I'm sure that they will do it as quick as they can. But I don't know. Probably a better question for them, actually.
Okay. And Dr. Levine, there's been several questions about compliance during, especially this past weekend. And like you, I've been doing an observation over the last few weeks of people wearing masks and those who are not. And there's a couple of demographic groups that seem to be really standing out. One is lesser compliance with middle-aged men and young adults, especially young women. And one of the comments from one of the men was, I'm not sick, I don't have to wear a mask. Could you address and in some way encourage people on they don't feel sick, they don't feel like they're going to die from COVID-19, but why they should wear a mask still?
Yeah, thank you for that question. That gives us a nice way to wrap up the press conference with an important public health note. We are increasingly getting educated about this virus, the coronavirus, and how it spreads. You may recall there was a very severe coronavirus called SARS well over a decade ago. We learned a lot from that virus, but almost everyone who caught that virus from someone else got it from someone who was very ill and very symptomatic. What we've learned early on in the game with this new coronavirus, the novel coronavirus as it was called, is that there's at least, and I'm saying at least, a 48-hour period of time before a person even feels the slightest bit ill where they can actively transmit the virus to someone else with simple acts like breathing and talking. Doesn't require a huge sneeze or cough at all. So because of that, we kind of talk about altruism, trying to be kind and trying to be respectful and thoughtful about our fellow citizens, and really make sure that we understand ourselves that by wearing a mask at a time when we feel well, we may be actually preserving somebody else's life. It could come down to it, somebody who might come down with the virus in a more vulnerable state and be severely afflicted by it. So the wearing of the mask is really to prevent transmission of virus through droplets that can occur in simple acts like breathing and talking, and that the person would not even suspect they were ill at the time. So hope that no one ever gets ill, but at the same time, I think you can understand that you can't predict that 48 plus hours ahead of time so that you're helping a fellow Vermonter.
All right, great. Thank you very much.
Thanks very much for tuning in. We'll see you all on Friday.